Oh my God. The ground is shaking. Oh!
In front of you, you have Langdang. Yeah, more than 150 guest house there. All down. The glacier. And this is glacier, this is ice. All this.
But I don't even see any wood. I don't see anything.
No, because it's below the glacier.
On 25th April 2015, Nepal was struck with a disaster it had long been dreading. A massive 7.8 quake and a 7.3 aftershock just 2 weeks later. More than 31,000 lives were lost and over 1,200 health facilities were destroyed, straining the country's health system to the brink. The response to the disaster by Nepal and the global health community was one of the best we have seen in recent times. We saved many more lives than were lost, but how can we replicate this response and make it even better?
Nepal is in the earthquake zone and we are aware of that. And therefore, we have to be prepared for any eventuality. There could be another earthquake. So we have to be ready for that.
Health facilities need to be able to withstand the hazards of where they are located. This meant retrofitting several major hospitals with steel bars to be able to withstand earthquakes of this magnitude. But not every hospital building in Kathmandu was retrofitted, and yet all 6 withstood the earthquake and continued to deliver services to the injured. This isn't just explained by where the quake hit hardest. It's because all of those hospitals had retrofitted and secured their equipment, like water tanks and lab equipment, things that hospitals need to keep functioning. WHO trained government and hospital staff and developed specific plans in the event of a disaster. They held workshops and ran drills until people knew exactly what to do when the earthquake hit. They knew who the first responders would be. Hospital workers knew how to accept the inflow of patients and triage them so that the people who needed care quickest got it. Hours after an emergency, there are immediate needs for a country before money is donated and before supplies are shipped.
I spoke to the Minister of Health within 2 hours of the emergency and asked him, what is your need? What do you want us to do for you? And he said, I need financial help and I need essential medicines. We could provide both.
This was possible because of a unique fund that had been set aside and could be activated with a single phone call. The first tranche of $175,000 was approved within 6 hours of the earthquake. Medical equipment to treat 40,000 people was pre-positioned to allow the country to mount an immediate response. During a disaster response, coordination of resources becomes complicated because there are many different teams on the ground. Without proper coordination, their efforts are duplicated, and that creates gaps. There are people somewhere else who could be getting help, but aren't. Medicines and supplies may go to waste. In Nepal, WHO coordinated around 400 health partners, which included foreign medical teams.
This is more than 100, about 120 foreign medical team. They have deployed in different places, and the more of 100 national medical team. They have also deployed in different places. The WHO has tremendously supported this.
To evaluate the work of medical teams and monitor progress in the affected areas, the Ministry of Health was equipped with an Emergency Health Operations Centre, a modular office where officials could report from the districts with a clear picture of what was going on, where there were possible disease outbreaks and what areas lacked water, sanitation and staff.
If we are looking at the onset of any diseases, I would think that most important is water and sanitation at the moment, because safe water becomes a challenge, sanitation becomes a challenge. Even here we are trying to push for bottled water. Tankers are being provided by the government. So we are trying to see that the chances of these kind of waterborne diseases are also minimized.
WHO also sent medical camp kits so that many of these medical teams could deliver health services in areas where clinics were destroyed. Strong coordination of people, resources and information makes for a strong emergency response. But it doesn't stop there. After a disaster, places like Nepal enter a long-term period of recovery, and this poses new challenges.
Support from different agency, now we are getting relief. It's good,
Yes.
but now the challenge is all the peripheral health institutions are damaged. So how to continue our health services? That is the challenge.
The long-term goal isn't just to rebuild Nepal, it's to build it back better. We are now back at the beginning, focusing on prevention and preparedness, training more staff and building safer hospitals in more places. The World Health Organization has brought donors, partners and the UN together to highlight the needs of the people and rebuild health systems in Nepal. Ultimately, we can learn from our experiences, look at all the information we have collected and the partners we have worked with, and use that to strengthen our collective response. Rebuilding after a disaster is an opportunity to be better prepared for the next.